Hello and thanks for watching Chunk and Check. Today we're going to kick off our paediatric series with the basics and look at history and examination.
Peds can be a bit of a funny one, especially if you've not had much exposure to babies. Most students think they're these delicate little things and are scared to touch them, but actually they're quite tough.
Still got to be careful though. The best way is to just throw yourself right in at the deep end and change a nappy. But saying that, I still can't quite do it. There's something about trying to hold both feet with one hand and slide the nappy under all at the same time. Just doesn't really work.
Let's kick off with the history. First things first, you have to decide who you're talking to.
Guessing age is hard enough, but trying to guess if it's mum or grandma can be even more awkward.
So just ask.
And if there's 7 kids in the room, it sounds silly, but you've got to check which one is your patient.
Once you've got yourself going, kick off with the usual presenting complaint and history of presenting complaint. Depending on the age of the child, you might get most of your info from whoever it is that's with them. But it's always nice to direct some of the questions to the child when appropriate.
And that helps build rapport. Ask about the symptoms as you would in an adult, but keep in mind that the differentials are likely to be different. A lot of peds is quite acute stuff, so kids get poorly all the time, so a sore throat is more likely to be a viral illness than esophageal cancer, for example.
Next, you need to find out how hydrated the baby is by balancing out their fluid intake and their fluid loss.
This is also assessed in examination, but while you're talking, ask about how much they've drank and if it was any less than usual. And how many wet nappies have they had lately, and find out when the last one was.
Have the parents noticed any cold hands or feet, or the child being mottled? Also, any drowsiness?
And the last one is more for examination, and it's rare that a parent will open a consultation with "my baby has a dry mouth," but do they have a dry mouth? If they're older, they'll be able to tell you themselves.
Next, we need to ask about red flags.
Let's get those in nice and early so we can act fast and change our plan before it's too late.
Typical red flags include things like a non-blanching rash, irritability, a floppy or drowsy baby, or a non-responsive fever.
The fever is a big one. Parents absolutely love Calpol. There are other brands available, but if this doesn't bring the fever down, then it's time to think a little bit harder.
You can remember red flags with the acronym FLAWS: fever, lethargy, appetite change, weight loss, and significant night sweats.
Another acronym next, BINDS. That's a great way to get a holistic view of the child.
Start at the beginning and ask about the birth.
It can seem a bit weird to do this if the child is 15, but it's still worth noting if there were any problems. If the child is less than about 5, then you should do that in more detail.
Ask about how many weeks gestation, bearing in mind that the normal is 37 to 42 weeks, and birth weight.
Were there any complications or any antenatal concerns?
How was the baby delivered? Natural, instrumental, C-section? If C-section, was it planned or was it an emergency?
And did the baby need any time in special care?
Immunizations next.
Just an easy quick question to ask if they're up to date with the UK Vaccination Schedule, and if not, find out why.
And it's important to remember to assume no vaccines if there's any doubt.
Nutrition next, bottle or breastfed, and are they being weaned?
Also note any problems with growth, allergies or weight loss.
And development, again only really relevant if the child isn't already fully developed. You don't ask adults what age they first smiled, but it's a bit more important in kids.
You don't need to go through all areas of development, but the parents will know if their child is hitting milestones on time.
And all babies take different times, but start to wonder if there's something going on, if it's taking longer than the siblings or if the parents are concerned.
And the S of BINDS is social. It's a good idea to try and draw a family tree.
Only if you've got time though. It's probably not ideal to spend 20 minutes of an exam situation discussing the whole family structure in detail.
Yeah, you need to get a good idea of who's at home and also who's got access to the child.
And that's important to find out the support network as well as possible transmission of infection. Ask if there's anyone else unwell at home and check if the family has ever needed a support worker.
Depending on the age of the child, you can ask about how they're getting on at school or nursery.
And kids always like to talk about pets if they have any. If they don't have any, that always triggers a family argument as to whether they're allowed to get a dog or not.
So let's move on to past medical history. Ask if the child has got any other medical conditions.
And explore that if you need to. Some of it might have already come up.
Drug history. You'll ask this question and most parents will be like, oh no, but when you start probing, they'll have a bit of a list.
Inhalers, creams, Calpol, all of this stuff counts, so you've got to check on these and note them down. Also ask when they were last given paracetamol if appropriate.
Also allergies, do they have any?
And we've already covered social history as part of binds, and this would usually come at the end of the history in an adult.
Have a nice little summary and find out about the parents' ideas, concerns and expectations.
And this will make sure that everything's been addressed and bring the history to a nice close.
Next, you'll move on to the examination. How you do this depends on the age of a child.
In older children, you can do an examination in a similar way to adults, but in babies, you need to do a top-to-toe examination.
We've got a video on this, so head on over here to check that out.
Thanks for watching, and just remember, try not to be scared of babies.
And try not to be scared of doing your silly baby voice in front of the consultant.
Thanks for watching.
Bye!